Welcome to SDF's second webinar on aspects of our COVID-19 response. I'm Dave Little, the CEO of Scottish Drugs Forum, so welcome to today's webinar, as I say. This one focuses on the challenges of responding to homeless people who have substance problems. COVID-19 and the lockdown present particular challenges for people affected by homelessness and substance use and the services working with them. We have brought together speakers from across Scotland to describe their local service responses from across Scotland, as I say, and hopefully that will help to inform responses for the rest of Scotland. We've got 4 speakers today, I'm very pleased to say. John Budd, who's from the Access practice in Edinburgh, Hugh Hill, who's from the Simon community, we'll talk about Glasgow, Lynsey Allan, from the Substance Misuse and Homelessness Service, Turning Point Aberdeen, and Danny Kelly from Hillcrest Futures in Dundee. What I'm going to do is ask for each of the speakers to speak for 10 minutes maximum, and that will allow about 20 minutes for discussion. If you look at the sidebar on the right-hand side of your computer, you will see a questions tab. So please ask any questions as we go along. Austin from SDF will endeavour to summarise the key issues being raised and to put those to the panel for the last 20 minutes. Any unanswered questions we'll endeavour to pull together and either get panellists to respond after the meeting, or we'll look at how we can potentially answer those for you. So if I can ask John Budd to begin. Thanks, John.
Thanks, Dave. And hello, everyone, from my kitchen sink. Yeah, so I'm just going to give you a little bit of an update, perhaps, in what we've been doing in Edinburgh, along with partner agencies, since really the COVID pandemic has really hit us. I guess one of the things that an approach we've tried to take is that this has really offered us a lot of opportunities to develop services and a way of working that we've been trying to develop over the years with, I would say, probably limited success. It's really highlighted the need for real, true partnership working from health, other statutory sector, social work, housing, and in particular with our voluntary sector partners. And I think that's something that we've really seen come to the fore in Edinburgh. Amazingly, in the matter of a couple of weeks, rough sleeping in Edinburgh seems to be solved. Virtually all people who are rough sleeping now have access to some form of safe accommodation. So the will is there and it has been implemented. This has offered a real opportunity to really more effectively engage with people who previously we really haven't offered a very good service for, I think. So what we are looking to do and what we have started to do is to develop a much more outreach focused approach. So we used to go into the night shelters maybe one night a week. We're now starting to go into the hotels where people have been housed who were previously using the night shelters or rough sleeping on a much more regular basis. So part of that is tied in with us specifically with the response to COVID. So we've been involved with street work, Simon community, in terms of they're setting up the COVID Homeless Hub, which is a residence which has isolation facilities, and we have a little health clinic there every day. We're able to test people who are symptomatic. We're able to isolate them while we wait for the result, which takes 24 hours to come back. And then we're able to group them or cohort them in an independent two independent 12-bedded units if they're positive. We're also on site to monitor folk in terms of health issues if they're deteriorating with COVID. And then we can also actually fast track folk into hospital as and when needed. Amazingly, we haven't had any positive COVID infected patients yet. Anyway, we're there, we're ready. We've got another cohort in, we're calling it a COVID care unit set up as well, if demand requires. recognizing that when people, in order for people to keep themselves safe from acquiring COVID and also for the risk of transmission, it's really important that people who have drug, alcohol, mental health problems are actually helped with those to enable them to keep themselves safe. So we've got 2 workers, 1 doctor, 1 nurse, well, a couple of doctors actually and a nurse, going out on a daily basis into outreach settings, hostels, B&Bs, trying to pick up folk who have got drug issues and want to engage and start opiate substitute treatment. So over the last few weeks, we've started about, I don't know, maybe 30 odd new patients on opiate substitute treatment, but same day prescribing. We're trying to assess and get them up to a therapeutic dose as quickly as we can. We're still mindful of trying to reduce our face-to-face contacts with folk if it's not needed. But I think at this point, the opportunities that are there far outweigh the risks of us either acquiring or transmitting COVID to our patients. And we're using PPE when we're out with patients as well, obviously. So I think what I'd say is that we've had unprecedented opportunities. We've been able to work with our public health colleagues very closely. We have an intermediary care unit setting up starting on Monday using Milestone House, and that's for people that are homeless coming out of hospital, many of whom will have complicated infections, COVID related or otherwise, but they can come there, finish their IV antibiotics, get their wider needs, mental health, substance use, social and housing needs assessed more fully, and then supported with partners, Cyrenians, into more appropriate supported accommodation. So that's a really exciting initiative, which we've been trying to get off the ground for, I don't know, the last 5 years, and it's happening within weeks. David Williams from our ADP has been a fantastic support and has really driven forward the proposal for a residential managed alcohol unit, and that's to enable folk who've got long-term alcohol problems to come into a residential setting where alcohol will be administered in a more controlled way to enable them to keep themselves safe. And again, you know, Tessa Parks has been doing research around this. We've been talking about this for years. With a bit of luck, it will be off the ground in the next couple of weeks. We're just identifying potential people that would benefit from that. What else are we doing? We've got a group of students trained up, working with third sector partners, Turning Point and CGL, to do methadone delivery. It's mostly the third sector partners that are doing that at the moment because we haven't needed to draw on a wider number. But as COVID, if it does take off and really spread through the homeless population, we have people who will be going out delivering methadone to folk where they're staying to enable them to self-isolate effectively. We're trying to identify who requires shielding, those people with often multi-morbidity and chronic difficulties who really need to be safe from infection. And again, we're offering them methadone delivery along with food and naloxone, and also needles exchange if needed. That's really just getting off the ground at the moment. And that's very much linked in with our third sector partners, but also social work colleagues as well. I've got another group of final year medical students who've been fast tracked onto the medical register. They haven't been called up into the hospitals because our hospitals are actually half empty at the moment for lack of COVID patients. So again, we're trying to utilize their skills, and I've got about 10 of them that we're looking to actually get them involved in outreach into hostel settings and hotel settings. We've got about 1, 2, 3, 4 or 5 hotels now filled up with folk that have come through homelessness. So again, it's a great opportunity to reach out to people who often we haven't engaged with very effectively. So I'm trying to get medical students involved with that, and also thinking about a training program for them, which they can carry through their careers, which hopefully will help address issues around stigma and the experience of our patients when they're in hospital. So again, it's a real opportunity to expose early years doctors and final year medical students to marginalized patients, and really try and shape their ideas and values a little bit with regards to working with our patients. So actually, you know, we haven't seen people with COVID, we haven't had people dying. This has been a fantastic opportunity, and I think I would encourage everyone. We've got to take them and make the most of it. There's the will, there's a bit of money there, and there's a lot we can do, and then we can take that forward after this pandemic. And you know, we never need to go back to rough sleeping and people being so marginalised. So I think there are great opportunities. I think that's probably me.
Great, thanks, John. That's perfect. Can I ask Hugh to speak next, please?
Hi, good afternoon.
Sorry, I'm just going to explain that Hugh can't actually appear on camera for technical reasons, but hopefully we'll get the gist of what he's going to say. Thanks. Over to you, Hugh.
Yeah, thanks very much. Appreciate the opportunity to speak today. Sorry I can't actually join you. My boss often says I've got the face for radio, so that's consistent with how Lorraine would like me to present the Simon community. Just very briefly, Simon community, we're a homelessness services, and our focus is predominantly on people with complex needs. So the kind of context to that is most of the people we support will have experienced some form of trauma in the past, and as they have journeyed towards homelessness during the course of that, they will have embarked on various different ways to manage that trauma, and drugs and alcohol, self-harm and various other unhelpful methods as part and parcel of their lifestyle by the time we're working with them. So they're a group who find it difficult to engage, or the world finds it difficult to engage with them for various different reasons. So that's for us, that set up one of the first challenges in terms of the pandemic occurring. This is not a client group that are well connected with media, with internet, with news and with the outside world. So we knew right from the outset that getting that message across about public health was going to be a major challenge, and that has indeed proven to be the case. We continually reinforce the public health advice to the people we support, but they are not the best group in terms of hand washing, social distancing or self-isolation. Our main concerns around the client group, and I would reinforce what John was saying, we haven't had a single positive case within our client group, and we haven't had a positive case within our staff group either, interestingly. But our concerns were with a client group that weren't going to be picking up the advice, that had significant health issues to begin with, and had major issues in terms of their ability to self-isolate. One of the responses to that was the formation, the establishment of hotels at a very rapid speed. So we get 3 hotels up and running effectively within 72 hours. And as John was saying, we've pretty much removed the need for anybody to sleep rough, certainly in Glasgow and Edinburgh. Some people are continuing to do so, but we have accommodation. We can accommodate anybody out there, and that's 24-hour supported accommodation. So it's not just a hotel room, we've got staff there 24/7. Since we started these hotels, since we opened them up, we're able to accommodate up to 140 people, and we've had 246 people going through. So people aren't just going into the hotels and staying there. We're able to support people to move on to more sustained accommodation. And within that, offer a lot of support around health and social care. So Edinburgh is a particularly good example, and John was talking about using that opportunity to connect with people that are generally difficult to connect with. So the amount of interagency work that's focusing in the hotel, from video counselling, from mental health services, sexual health are in every day, public health are absolutely playing a blinder in supporting staff and service users with smoking cessation, giving advice on PPE, how to put it on, giving briefings on COVID. So an amazing amount of work focusing in on the hotels in terms of supporting staff, service users, to actually really grab that opportunity to do something very different. One of the challenges that we've had from an operational point of view, and I'm sure most of you will have had this as well, is how do you actually maintain and continue your services? We anticipated a significant reduction in staffing, so we made an early recruit by up to 20%, So we introduced a rapid recruitment process, and we recruited 14 permanent staff and 36 temporary staff within 2 weeks, giving us the headroom to be able to not just maintain all our services, and I'm glad to say that we have done. So our street teams are still out in the street and we're still delivering our 24-hour services. We've had to redesign some of those in terms of remote working, and our hub in Glasgow has gone mobile, so it's delivering its service out in the street now rather than in a building. But in addition to that, we've also been able to deliver the hotels. Things have settled down now. The number of staff that we've got are self-isolating is reduced significantly. So our main challenge now is actually finding the space to get 2 meters between our staff, because we've got so much capacity. But I'd much rather be in that position than be struggling to find staff to manage our services. From our service users' point of view, some of the sort of challenges they faced have been really trying to understand what's happening. As I say, they're not well connected with the world. So whilst we are spending most of our time understanding and listening to Donald Trump talking about cures for the coronavirus, our guys are not connected to that at all. So that they're confused and they're unsure, and they're a little bit pissed off, to be honest, that services around them aren't as available as they used to be. But that's also having the same impact on drugs. Although having said that, we keep getting mixed messages in terms of both availability and the quality of the drugs. We are hearing that heroin is getting harder to come by, and it is being cut more, so the quality has gone down, which may increase risks of overdose in the future if that changes again. We've seen some pickup of gas and solvents, that not in any great extent, but in an extent that we haven't seen before. And some of that is also related to a significant reduction in the begging revenue, because you've not got the footfall in the cities as well. Most of what we're picking up is anecdotal from what we're picking up on the street, but in some cases it seems to be difficult to get drugs. In other cases it doesn't seem to have changed at all. So we're not sure exactly where the risks are sitting at the moment. One of the positive things that we've come across is the move to 7-day supplies for methadone. And our services have really picked up the mantle on that one in terms of supporting people. And two of the things that we've found from that process has been its really positive impact it's had on service users in terms of their confidence, their self-esteem, and their ability to have control and manage with support their supply over a 7-day period. But the other kind of unintended consequence of a positive is our service users will often tell us that, you know, on the way down to the pharmacy, they'll be approached up to 3 times by dealers, even offering them free stuff to try and sort of ensure they keep that customer base. But if they're only going once a week, they're not getting harassment from the dealers. So some of our service users are in the most stable position they've been for many, many years in terms of their drug use, and are actually beginning to engage in services in a way that they didn't do before. So that's been hugely positive, and certainly one of the things I think as we move forward, I think there's opportunities to maintain some of that approach in terms of supporting people. So for us, I mean, it's been a really challenging period of time. I expect our journey's been the same as most people. The first 2 weeks, we were probably 2 days behind ourselves every day. The next 2 weeks, we were just about catching up. And probably over the last week, we're beginning to look ahead now, rather than just actually trying to respond to what's right in front of us. It's been predominantly positive, I would say. And certainly our concerns and our fears about the impact on health and the impact on the client group of COVID-19 hasn't materialised, and we are incredibly thankful, if not slightly puzzled by that. Impact of things like 7-day take home has been really positive. The examples of interagency work in Edinburgh is absolute standout in terms of how people have come together. In Glasgow, it's been about connecting with existing relationships and making things work. You know, it's the flexibility and creativity to get things done has been exceptional, and it's not always been about the money. There is money available to make things happen, but a lot of the change has come through people's commitment and passion desire to make change happen and to do something different. I think looking forward, some of the challenges that we're seeing possibly round the corner is we have a significant number of people now in temporary accommodation. We need to move and support people to move into settled, sustained and permanent accommodation. None of us want to see any of these guys back out onto the street. That would be a huge retrograde step, but we've yet to figure out what that step forward looks like, but we're beginning to talk about that and beginning to look at that. I think in terms of costs and budgets, I mean, none of us really know what the impact nationally is going to be on the economy and on ourselves in terms of the cost. But from an organisation, I don't think we'll actually really understand how much this has cost the organisation until it's all over. And that's around things like staffing and investment in technology, making sure people get fed, the logistics of moving stuff about, and the ridiculous amount of money that we've had to spend getting PPE to ensure that our staff are safe and able to deliver the service. We are looking now to create a specialist role, particularly around harm reduction, and hoping to work on that next week and go to market next month in terms of bringing someone in, because we've recognised that, you know, there's so much intelligence out there that we're not getting, and there's a consistency of approach that we really want to sharpen up on. So we're learning lessons from this all the time, and we're looking at how we change our future. And I think there's some really interesting discussions to come about how we create that different kind of future that isn't about going back, that's learning about what we've been through over the last 4 weeks and what we're continuing to go through, and about what the future is going to look like. And I think that's me about 10 minutes. Thank you.
That's great. Thanks so much, Hugh, for your presentation. Our third speaker is Lynsey Allan. Over to you, Lynsey. Thanks.
Hi. I have to say I'm not going to come on and say anything significantly different to the contributions already made, but perhaps maybe give a bit of a local picture about some of the things that we're doing in Aberdeen. Many of the issues have been well highlighted by Hugh and John in previous talks today. I think what's important to mention is that some of the early work that we have done with our new service in Turning Point Scotland in Aberdeen, which is focused around providing outreach housing support to those who are aged 16 and above, who are from rough sleeping in temporary accommodation and into their permanent accommodation. The service began in 2019 in November, and it was part of a wider systems change approach in Aberdeen to homelessness in general, with the aim of reducing repeat homelessness and increasing tenancy sustainment. So our service is and has been outreach focused since November, and we are working with people who are on kind of medium to long-term needs in terms of their housing support. Many of the issues that we see, again, as you said, they're multiple, they're complex, including mental health, substance use, domestic violence, all kinds of different issues. And I think the redesign and some of the fundamental changes that were made prior to the COVID have really helped facilitate how we coped with the initial periods of lockdown. One of the biggest impacts that have begun to change conversations about homelessness in Aberdeen is our multi-agency weekly hub meeting. And that is third sector providers, also third sector providers who are providing support to those who are homeless or at risk of homelessness, as well as statutory partners. We also link in with our city ADP on cases that we need to, as well as other agencies, including Police Scotland and Public Health and National Health Services. So we've continued to continue to have our discussions, our weekly discussions virtually, and our focus is talking about really difficult, hard to reach cases, really complex situations, any adverse events, any risks or concerns, and we also use that as an opportunity to transfer cases and make sure that people are in an adequate part of service provision and get the support that's right and tailored to their needs. So having done the groundwork in November to facilitate that way of working, it really has benefited us when it came to a lockdown situation, in that we already had a platform to begin to have these conversations. Very similar, the first 2 weeks were very much crisis response, chasing our tails, not really understanding how or what methods we could use to continue to support people. We were constantly feeling like we were behind, and as the weeks have gone on, we have felt more settled, more confident with some of the approaches that we're taking. Certainly much more partners involved around the table in identifying those who are most at risk and those people that we need to be reaching out to. We, this week again, have become more settled and are beginning to look forward. We are doing very practical support still out in the community. Turning Point Scotland have re-provisioned their social enterprise cafe, and we are using that as a way of making fresh hot food every day and distributing it to a list of our service users who we feel still need that daily contact, welfare check, drop off food at the door, just to make sure that people are okay. And currently I think we're delivering to around 120 households per day. And that has really been the key to getting into some of our most difficult people to engage and keep engaged. We've also used that as a way for other agencies to get in touch with us who are not able to go out in the community or knock on doors. We have, for them, gone out in the area that we're in and done that welfare check and passed on to our colleagues in substance misuse services, for instance, or Aberdeen City Council, that the person's safe and well, and maybe re-engage them by giving them a new mobile phone or a new number to call as well, so that we can make sure that they're re-engaged with the most appropriate service. We spent a lot of time in around week 2 or 3 cross-referencing all of our people who were in our services who were open to drug and alcohol services in Aberdeen, which I think has been a really proactive way of identifying our service users who are most at risk of falling out of prescription or specialist services, so that we can make sure that we are getting that at the earliest opportunity. All of our housing support workers are naloxone trained for trainers, so we are able to train people and give out naloxone kits. I'm aware that Aberdeen Alcohol and Drugs Action are also doing postal and outreach needle exchanges as well, making sure that people have safe equipment and harm reduction materials as well. And we have taken the opportunity to kind of traffic light our service users into red, amber and green, so that we know the level of need that we need to be responding to. So we know people who will need daily support, we know people who will need that kind of every check-in every couple of days, and we know people who are doing really well and coping really well and actually coming into their own, and their confidence is increasing because they have become more independent away from services. I think as time goes on, what we are focused on is trying to keep people engaged. So I think we've got really good at the crisis response. I think we've got really good at thinking about how we're dealing with complex cases. I think one of the things that we need to focus on is how we get people engaged and included digitally, so that we can make sure that they are having a wealth of resources to access. And there has been an incredible amount of things that have gone online, and webinars and Zoom meetings and recovery groups have moved online. And we just need to make sure that there's an equitable way for people to respond and access that. Many of the people that we're working with aren't included digitally, and we need to, if we are going to think about having a lockdown scenario for a further few weeks, how we're going to keep people engaged into recovery groups, into support groups online digitally. I do think that some of the other issues that Hugh was saying are the same in Aberdeen, in that we're finding it really difficult to keep those who really do have multiple and complex needs in their own accommodation and self-isolating or adhering to public health advice. So we are trying as much as we can and using the methods that we can to be able to encourage that. But as Hugh had quite rightly pointed out, many of our service users don't really understand what's the expectation on the consequences, because they haven't been listening to the news or going online and reading as many documents. What I would say is, in terms of rough sleeping in Aberdeen has always been a very different picture from that in the Central Belt in Glasgow and Edinburgh. We've always seen reduced numbers of rough sleeping in Aberdeen, and I'm happy to say that that's continuing. We do have a rough sleeper who we are working very hard to get into accommodation. He has lots of options. We're continuing to work with him on that. But the rest of our people who would have been rough sleeping or at risk of rough sleeping are being picked up in the normal way, which is quickly and rapidly, and into temporary accommodation, or very, very few people are actually in hotels in Aberdeen, but there are a few. So we are working in that kind of rapid rehousing response as well. So we didn't have the same difficulties as other areas in terms of addressing rough sleeping. But what I would say is that we would be as proactive as others to make sure that those systems continue to be the systems so that people don't return to rough sleeping. I think some of the, again, anecdotal information that we're getting back from our service users on drug use, drug tends, is very similar to what Hugh said, in that we're getting a mixed picture. Probably more in our rural areas in Aberdeenshire, what we're seeing is a slight increase in drinking alcohol as opposed to using drugs, and online seems to have, people getting drugs online seems to have been, we're hearing more and more of that, and obviously people taking more risks in terms of changing their drug use pattern. But again, that's all anecdotal and things that we're getting back from our service users. I think just to end on a positive note, like the others have said, I'm really overwhelmed at how quickly people have come together, not only within my own staff team, but in other organisations, people who have come together and looked at doing things really, really differently. I think we've taken a lot of learning, and I think that there are real positive things that we will seek to hold on to as we come out of lockdown. I think that's probably me at my 10 minutes, Dave, so I'll let you hand over.
That's great. Thanks so much, Lynsey. We'll now move to our final speaker, who's Danny Kelly, who will talk about the situation in Dundee. Thanks, Danny.
Hi there, folks. Okay, so I hope I don't reiterate a lot of what's already been said. And I appreciate, like, we've covered quite a lot here. So I'd like to thank Hugh, John, and Lynsey for what they've said so far. So apologies if I'm kind of duplicating things that have already been said. So just to give a brief overview, Hillcrest Futures is a third sector provider. We support adults and young people around substance use, which brings into homelessness, rough sleeping, obviously, into that, and people with mental health and whatnot. So just going back to when the kind of pandemic started, looking from our kind of IEP needle exchange service, we identified this as a service obviously that we'll still be providing. So what we wanted to ensure that the adequate staffing and cover was in place, and that the staff there were able to support that as best possible. So the first point of contact there was to ensure that the upskilling of staff. So we have young people services where we're supporting young people around drugs, alcohol, and sexual health. And as well to that, we have services around like community recovery. So it's about kind of seeing staff there and upskilling knowledge and skills to be drafted into support IEP in the first instance. So that was great. And again, just kind of reiterating that last point that Lynsey made about kind of staff teams coming together and that real kind of emphasis on in this together kind of thing, as we're kind of reiterating. So in terms of IEP, the first thing that we were kind of identifying was around what's been mentioned already, the postal IEP and the opportunities around there. We currently see around about 400 people, 400 transactions, a month. So I was recognised that we needed to do something quick if there was a potential lockdown to come, which obviously evidently it did. So we were within the first week of going into the kind of the pandemic starting around about that kind of 14th of March time, end of March, sorry, we were setting up our postal IEP, and that's kind of hit the ground running. We've kind of went strength to strength in terms of how much we're sending out to people, and we're identifying. It's interesting because generally we will have always had more males than females coming into the service, accessing the exchange and support, but through postal we've actually seen an increase in females using the service. So we're trying to kind of obviously having a bit of phone contact and speaking to females to identify kind of maybe reasons behind that, and to kind of gather a bit more information around kind of looking into why that is. So we're still providing face-to-face needle exchange IEP service. This is obviously within guidelines of kind of social distancing. Staff are using PPE. This has been a great way still to keep a service that is there to keep that going. The hope in terms of the homeless population coming in, this has still been an ongoing population that are using the service. What we are now starting to see is that we've introduced, and we're able to introduce. We had Social Bite were giving us food, so we're basically getting meal deals, which we were able to offer twice a week, and on top of that, we've had Fair Share, which are now delivering food for the other days of the week. This has been great in terms of what we're hearing from a lot of people who are homeless and even within hostels and whatnot, is they've access. There was a lot of other organisations that maybe not still providing that same service in terms of getting a hot meal or food and just having that face-to-face conversation. So I think that's where the food, I know that's been kind of spoken about already quite a few times, but I do think in terms of that kind of mental health and social isolation, somewhere where can access some food, and albeit maybe not get that same sit down and that kind of maybe that cafe atmosphere, but I think that's still going helping to a certain extent. We have seen an increase in terms of food parcels, in terms of the referrals that we're making to food banks. So just in terms like food poverty at this time, to keep in mind of that, we are funded through the NHS, and we work in partnership with our specialist NHS nurses who are still working alongside us, providing specialist wound care to anyone that's needing that essential support around any wound care and maybe not accessing that anywhere else. All staff have been upskilled in terms of the lock zone, and we're still providing the lock zone. And just to say as well, within the postal IEP service, we're sending out, we're able to distribute in the lock zone as well. Now, I'm just going to skip on to a little bit onto what we've been currently involved in Dundee as a non-fatal overdose pathway. This came about on the back of in terms of the Dundee Drugs Commission, and looked at a proactive response to drug-related deaths within Dundee. Hillcrest Futures has played a key role in assertive outreach and responding to the needs, where we are identifying non-fatal overdoses and being able to respond in a proactive and timely manner. This is something that I'm delighted to say that I was able to kind of continue through this current situation, which has been great in terms of, as I say, we're still operating as a service, so we are still seeing or at least hearing of individuals. So basically a daily call with a NHS public health, and we're a member, we're a part of that call. So it means that my staff who are kind of supporting that can feed into that, an update of any situation. And it means, again, just going back to that kind of that timely response. So if we identify that there's been a non-fatal overdose within the city, we can look at the best way to potentially, if it means in providing some kind of intervention, whether that could get in the lock zone out, giving phone support, or looking at some kind of way of outreach still within the kind of current guidelines. So that has been a really good kind of thing that's continued into this, but we just needed to adapt the way that we're having to deliver that. Following on from that, as well as a kind of said, we kind of reassessed where our staffing had to be in terms of essential services. We're also, Hillcrest Futures staff have also been supporting community pharmacy in terms of social distancing. I realised with the influx onto community pharmacy, there was a need to support with like queues as such that have been building up outside pharmacy, and to manage these and to ensure that there was support and adequate kind of knowledge and support within the communities to do that. So we've had staff that have been supporting with supporting the pharmacies, and this has been around, if it's been again around the lock zone or any just general kind of social distancing. Probably again, this has been said already, but what I'd probably say is we have identified that the kind of whole messages around hand washing and social distancing within some of the population has been messages that we've had to really kind of hit home, and we're still on an ongoing basis. And that's where we've had to try to be a little bit more creative and around kind of marketing and how we're kind of getting that message across. And I think as a whole, we've kind of got to realise that, as it was mentioned as well, maybe not everyone is always listening to what the news are saying and what's coming out in media and whatnot. So it's how we get that message across and how the staff are delivering that. So I would say that that's kind of been a key ongoing message to ensure that everyone is trying to adhere to that to the best they can. So moving on to, so the next thing I would probably say just to update on would be around, we've always had a safe zone, well not always, but the past few years I've been supporting a safe zone bus within Dundee, and I suppose at this time we're looking at what resources can be utilised to be used to support, especially around homelessness and sleeping, begging within the city. One of my colleagues from Health and Social Care Partnership has been key in moving this kind of project forward around utilising this kind of asset in terms of having a multi-agency response where we could have a number of key staff around health and homeless outreach, parish nurses, harm reduction, young people services on a rota type basis, going out potentially 2-3 evenings a week to identify in any areas where there may still be street begging and rough sleeping taking place. So I think again it's trying to look at what ways we could still potentially provide an outreach service that is staying within kind of recommendations of social distancing, but still provide a service that is meeting the needs of this population. And this is what we're moving towards at the moment. Another thing that we're looking to do, that we've just kind of set up, is we recognise that with the recent announcement of some prison liberations, we're looking to set up mobile phones that we can give to those more vulnerable and isolated individuals being isolated, being liberated through the prisons. In this way, we've kind of recognised we've had a couple of individuals coming in from Dundee into Needle Exchange, who have said that they've been living within a network flat where they've maybe had not as much access or support, or they're feeling a bit isolated at this time. So we're just trying to think a bit outside the box and maybe get some mobile phones that we can give to people to keep in touch, and also they can get in touch with other services and basically stay connected at this time. So that's something that we're looking to move forward with straight away. In addition to that, I've already mentioned about IEP support and support within community pharmacies. In addition to that, staff have been supporting with delivery of OST with the ISMS service within Dundee to people who are self-isolating, shielding, etc. We've had 2 members of staff at the moment who are doing this in terms of keeping to, again, social distancing and whatnot. But this is going well, and I think it's always been mentioned in terms of third sector's role in supporting OST delivery, and I think it shows the kind of value of third sector in terms of able to upskill and do this at this time. And I'd probably say again, hats off to staff who have kind of taken this and kind of what the word out, yeah, who have moved to this very efficiently.
Brilliant, that's great, Danny. So, sorry, just to do you want to conclude there, just because I'm conscious we won't have much time for questions, but unless you've got one final.
Yeah, the final point I was just going to say, sorry, it was just around about, I'd probably say maybe looking at people who are 16 plus, maybe that's 16, 17, who are potentially maybe been through placements or not currently engaging with where they're living at the moment, and these guys are potentially the ones that are maybe needing a bit further support. And so we'll be looking again to work with partners to look at more assertive, maybe more some kind of outreach towards that kind of younger population.
Okay, thanks, Danny. That's terrific, and thanks to all the speakers. If I can ask the speakers all to come back in now, and I'll ask Austin as well to come back in as well, so we can look at specific questions that you've all been patiently asking, and hopefully we'll get some answers to. So, Austin, can I pass over to you? You need to unmute yourself, Austin.
Sorry, I'm sorry. I thought somebody else had control over that. Okay, thank you. There's a few questions which are specific around housing and homelessness issues. I could maybe combine them. One of them are people who, not people who've been moved on from rough sleeping, but people who've been in B&B and hostel accommodation. Are they eligible for and receiving testing? And the other one is about, are people being moved into hotels who actually aren't entitled to housing benefit, foreign nationals who aren't entitled to benefits and so on? And if they are being moved into the hotels, what's likely to happen to them afterwards?
Hugh, do you want to take that one first?
Yeah, I'll pick up on the people without recourse to public funds, because certainly both in Edinburgh and Glasgow we've got a fairly significant number of people now who are who would fit within that category. What we're currently doing is we have an EUSS scheme already, and specialist staff in Edinburgh who are working with that group as they come in to look at their entitlement, their treaty rights, and their settled and pre-settled status. And we're talking to Shelter and Just Right Scotland in Glasgow about a specific project, a specific piece of work that we can bring to play pretty quickly to support the guys that we've got in Glasgow as well. At the moment, what we're finding is a lot of people who think they're not entitled, with the right kind of advice and information, they actually are, and we're able to make some progress there. In terms of the long term, I can't answer that. I don't think any of us can at the moment, and that's one of the major challenges I think we're going to face, particularly in Edinburgh, where we've been supporting quite a significant group of European nationals who have been destitute and rough sleeping around the graveyards and the parks in Edinburgh. They're off the street now. They are getting support. They have opportunities, or opportunities are presenting for them to change their lives because they've actually got some stability now, and we're working to do that. And some of that change is about employment, which is what brought them to the country in the first place. So we're doing everything we can with what we've got at the moment, but the longer term position in terms of how we get people into long-term sustainable accommodation who don't have settled status and don't have recourse to public funds, yeah, big question that we're needing to answer.
Okay, thanks. Anyone else want to add to that? John.
Do you want me to just pick up on the testing for COVID question?
Yeah.
Part of that question. So certainly in Edinburgh, Public Health have been fantastic working with them and Health Protection. So we have a pathway in place that for anyone in a non-NHS residential setting, in other words, hostels, P&Bs, or anywhere else that's communal, as soon as someone is identified as being potentially symptomatic for COVID, then the unit inform Health Protection with a number that's been circulated to everyone, and we also at the Access Practice are available for advice. Basically, the call is triaged. If someone is symptomatic and able to self-isolate, which really means that they have their own bathroom and their own kitchen, and are also psychologically able to do so, so they're not alcohol dependent or not or drug dependent and needing to run around getting alcohol and drugs, then the advice is to self-isolate and just to monitor folk over the 7-day period that they're symptomatic, unless they've got a fever, in which case it's a further 48 hours from when they're fever free. If they are not able to self-isolate, then we've now got access to transport through the NHS to transport them to one of our COVID care units where they are isolated and tested there. If they are positive, then they go into our COVID care bit. If negative, then they go back to where they were. Coming to the COVID care place, it means that we can help support them in terms of their alcohol issues. So we've been doing a few alcohol detoxes. We've also been initiating folk onto OST rapid access, so they'd be started off on OST if they were willing to do so. I should say, actually, what I failed to say was that once people are notified to Health Protection, anyone in a communal setting will be tested by the community outreach team for COVID.
Okay, thanks, John. Anyone else want to pick up on that point, or we'll move to another question? Austin.
Yeah, so I'll try and combine questions to get as many done as we can. One of them is just a straightforward question: is everybody's area able to provide same-day prescribing? And another question is: are we capturing user experience of same-day prescribing, 7-day prescribing, and so on, to make the case to sustain these after this is all changed back again?
Lynsey, rather, sorry, can I bring you in?
Yeah, I think all areas are probably had already been doing same-day prescribing or are moved into that as well. I think in terms of capturing service user feedback, I'm not sure that we've been doing that as an immediate thing, and I do think that the focus of getting all of these systems in place was very much trying to get that crisis response. But I do think that as things, I think we mentioned, all of us mentioned, that certainly this week things are beginning to feel a little bit more settled. It is some of the questions I think that we will need to begin to ask ourselves, to take some of the learning of some of the new approaches that we've been doing across all of the areas, learning from each other as well. I know that there are some system changes in my services that I'll be keeping in terms of mobile needle exchange, certainly in our very rural areas in Aberdeenshire. It was almost a light bulb moment of why haven't we done this bit before? So there are lots of things that we will keep, and of course service user feedback and those who are using services is incredibly valuable. And I do think that as we begin to settle, we will have more of a focus on how we can collect that in an effective and meaningful way.
Okay, thanks, Lynsey. Danny, do you want to add to that?
Yeah, I was just going to kind of just say in terms of I can't comment regards the same-day prescribing. That's not my area. However, just regarding service user feedback, I do kind of probably reiterate what Lynsey's saying. I think the first few weeks in terms of lockdown, in terms of trying to provide that immediate intervention, immediate response, and I do think we're now at that point where like that we'll want to see what has been working well and what can we be. I think there's been a lot of good learning and a lot of good work that's been discussed and put into action, and it's not just now about the current time and the current situation we're in, but what can we progress on after we're out of this kind of pandemic and how we are at the moment. So I think it's future learning as well.
Hugh, do you want to just specifically around the same day prescribing, what's your experience in Glasgow of that?
Yeah, I'm afraid I can't really say a great deal about that. I'm not that close to the ground in terms of how that's happening, but I would just reiterate what everybody else is saying, is we're doing a lot of things just now, kind of shooting for the hip. And I think in terms of getting service user feedback about what's worked for them and what hasn't, will allow us to modify our services moving forward. And I don't think any of us will be doing things in the same way once this is finished, but hopefully we can do it in a way that really does suit service users. And particularly things like mobile outreach, integrated working and same day prescribing are keys to actually reaching people in need.
Thanks, Hugh. Austin, have we another question?
Yeah, we have several. Unfortunately, there's not a lot of time. Several questions, or 3 or 4 questions about the hotels and drug and alcohol use in the hotel and how that's managed, and about the crisis in terms of increased risk, and has there been an increase in deaths? And I suppose one overarching question, I suppose, which would sum up a couple of inquiries, have been about what does this look like when we come out the other side? What does recovery look like from the COVID outbreak?
Hugh, do you want to pick up on that point first in terms of drug and alcohol use in hostels and hotels?
Yeah, I mean, certainly I would say in terms of the hotels, it has been incredibly well managed by the staff, not just the staff who are on site, but the visiting harm reduction teams, the GPs that are coming in, John Budd's team. I mean, just incredible amount of support going in to stabilise people's drinking, to stabilise their drug use, to get them onto ORT. So everything is in place and it's actually working really, really well. In terms of deaths, no, we've not had any deaths in the hotels. There has been some overdoses, but they've been responded to by the staff, and it's been very, very successful in terms of response, but nothing peculiar, nothing unusual. In fact, if anything, it's been much more managed and much more stable, and people are much more supported.
Thanks, Hugh. Anyone else want to come in on that point specifically?
I think just a point about we aren't using hotels in the same way as other areas. People who are in temporary accommodation through either furnished flats or hostels or accommodation units. So, but I think in terms of answering the question regarding about what it looks like for people in recovery as we move out, I think it's a really difficult question to answer. No one really knows what anything will look like as we come out of lockdown. I think there are some reassurances though that services are more joined up, services are more willing to talk to each other. We've proved ourselves on a few points that actually have taken us many years to resolve and many different types of service provisions. So I think whatever the picture looks like moving out of lockdown, it will be certainly continue to be more joined up and hopefully to the benefit of all who are using services or are looking to use services.
So thanks very much, John. I mean, I suppose that's the same question to you, but also, just that one about how we sustain all those positive changes that we've heard about longer term. You have to unmute yourself, John. Sorry.
I think I might be unmuted now.
You are, yeah.
Yeah, if only my kids could do this to me so easily. But yeah, I mean, I think obviously recovery from us as workers and for our patients and clients, one of the key things will be all these positive developments. If we can keep them up and to really establish them as just routine parts of our service that we offer. But one just observation I'd like to just share. One thing I've noticed going into the hotel run by Streetwork and where we've got our little house room and stuff, increasingly I've noticed that folk who've been, come in from rough sleeping and other sources, residents, I'm seeing them around the hotel with the vacuum cleaners, with the marigolds on, with the squeegees, wiping the door handles, and really, you know, for me, you know, coming in, it seems like a real palpable sense of people really sort of coming together, having something to contribute, and it shifts those dynamics. Like we're alongside folk who are coming, you know, as co-producers, and I think that would be a real learning thing for me to take forward about how we continue in that sort of co-working with our service users, because that's what we're really, that's real recovery. I think that's yeah.
Thanks for that, John. I think sadly we're going to have to end on that note, but it's a very good note to end on, and I think we'd all share that view that we have to embrace all the positive things that have happened during this period of time. So, as I say, sadly we're out of time. We have recorded this webinar, and we will put it up on our website. Also, we'll send out a short evaluation of this webinar, and also if you want to give us your ideas for future webinars. And on that note, we're going to have a webinar at the same time next week, looking at benzodiazepines. It's maybe something we'll reflect on, having 4 speakers today, that maybe 3 speakers is actually better and will allow more time for questions. So apologies that you didn't get to answer or get to have answered all of your questions, but we'll endeavour to do that after this meeting. So something I forgot to do last time was to thank all the speakers and for all of you for attending. We've had, I think, 240 people in total today, so which is you know, really great for us to have that level of engagement, and hopefully you've enjoyed today's webinar. So thanks very much for joining us. Goodbye.
Thank you.
Bye.
Thanks.